We're going to make a left turn to go into psychiatry and mental health for a moment. Dr. Brandon, I'm so excited to have you on because you are a gut brain axis expert. I'm curious how you see conditions like MCAS impact mental health, and does this ever impact the correct diagnoses of mental health conditions?
Yeah, definitely. Well, one thing I do want to say though, Kelsey, is it's not a left turn because mental health and physical health cannot be separated from each other. So they really are just like on the same parallel pathway. If you're not treating mental health, it would be really difficult to treat your physical health to completion. And with that in mind, right, MCAS and psychiatric conditions, they have this neurobiological overlap to them. So I end up seeing tons of patients. They've seen, a lot of different doctors. They've experienced maybe even problematic medications that they've been given. Doctors really want to help people. And so sometimes they get lots of drugs that don't end up helping them and even could be ending up harming them. I do want to say just a quick plug that anything I'm talking about is educational only, not medical recommendations or advice for any patients, because I'm reading the chat and I know people are sharing their own personal advice, but this is just educational information, of course. But when I think about a patient that's coming to me that maybe has failed lots of different medications in the psychiatric world, maybe a lot of doctors have said, like, I think at this point, this is probably more of an anxiety diagnosis for you, or even a brain gut axis diagnosis that is just not responding to what we would think of as like traditional treatments. Sometimes it starts to ring bells in my mind of what are we missing? We always have to step back and be humble about what is the diagnosis that we're actually treating in this case. And one of the major things that, well, there's two ways I think about this. There's probably an underdiagnosis of MCAS. There's a lot of psychiatric symptoms that can look that MCAS can make you look like. So there are reports of anxiety, depression, bipolar disorder. People are misdiagnosed with these psychiatric conditions. And in fact, there is such a huge overlap that like they might actually have MCAS, or they also have MCAS, right? Those things don't have to be mutually exclusive. But it's worth making sure that we're ruling that out or ruling that in. And as the other panelists were saying, it is difficult sometimes to fully rule that in or out. So trying things and being thoughtful about the patient's symptoms and seeing if other things could be helpful or other testing could be helpful is important. But there's also, Dr. Ivanino was saying, there's this huge explosion on the internet of everybody saying, just take Pepcid and Zyrtec and you're good. There's also like an overdiagnosis, I think, of MCAS to some degree. There was a study that was, 2% of 100 patients, so 2 out of 100 basically, that were suspected having MCAS actually had it. And then 65% of those patients also had anxiety or depression symptoms. Most people don't want to hear about psychiatry when they're suffering physically so badly. And I just, again, want to plug that these are not separate things. You can have MCAS and be impacted psychiatrically with that. And you can also have psychiatric symptoms, and those are worsened by MCAS as well. One of the main drivers for that is actually a tryptophan dysregulation. And the corticotropin releasing hormone dysregulation in our body, where if we're stressed, whether it's a physical stressor or a psychological stressor, cortisol is being activated, and that's impacting the entirety of our body. Like our whole immune system gets sort of set on fire, and mast cells are, of course, a part of that. So it's impossible to separate them out. And it's also really important to make sure that we're treating both of those things and getting the doctor, like all the doctors talking to each other, right? Like that's why this kind of a panel is so important, so that nobody's in a silo of saying you either do or don't have mast cell activation. The doctors talking to each other is one of the things that I find most important and most empowering for patients, to have a better sense of getting the correct diagnosis and feeling heard when they're working through this, and not being told like it's only in your head, or there's no chance that it's also anxiety that's worsening things for you.